Hey, good afternoon. Welcome to our Facebook Live broadcast. This is Dr. Bill Bird. I'm the Chief Medical Officer at CGH Medical Center, and glad you could join us. So today, I'm looking forward. We're going to talk to some of our folks from the lab. We're going to talk to Cheryl Baker, who's the manager for our lab, and talk testing and those type of things related to our pandemic, and then Dr. Farzan Eskendari, who is our medical director, our pathologist in the laboratory, and I want to ask him some questions about the latest and greatest on different types of tests that are available for COVID. So we'll get into that. You know, I was on a lighter note. We were talking before the podcast, and it seems like now that we're getting more towards the fall, I'm getting paler and paler. So sorry about that. I think I need to get some sun somewhere. Not that I don't know if that's going to happen, but anyhow, So as we're going through this, as always, I'd encourage you to, if something comes up in terms of a question you have, fire it away, fire it to us, and we'll do our best to answer it for you. So with those things out of the way, let's get Cheryl in here. Hey, Cheryl, where are you?
Oh. I am. Hello there.
Hi, good to see you.
Good to see you too.
You're supposed to say good to be seen.
Yes, good to be seen. Yes.
All right, so Cheryl is our lab director or lab manager at CGH. And did we have you on here like a number of months ago, Cheryl?
No.
Oh, I didn't? Okay, so you're a long-time listener, first-time caller.
Yes.
Something like that, right?
Yep.
Okay, good. Well, Cheryl, needless to say, with a pandemic going on, Cheryl and her team have been a big, I didn't even throw the word huge, part of what we're doing to help take care of folks here at CGH in terms of this pandemic. So I'm glad to have her on. And I'm going to start out with just some nuts and bolts stuff with you, Cheryl. You ready?
I am.
All right. So just what are our current numbers in terms of COVID testing here at CGH?
So we started testing back on collecting back on March 12th. Seems like an eternity ago. And we are up to, as of this morning, we have collected 7,508 COVID specimens here at the hospital and at our Ready Care. We have had 536 test positive, and we have
536.
536.
Yeah. Okay.
And we have 6,846 that have been negative.
Okay.
And then the rest they're out waiting to be resulted. So,
you know, you and I have been talking about this, Cheryl. So, in the last few weeks, what's the deal? What's going on?
Well, we have definitely seen a huge uptick in our positivity rate. I think from March until about a month ago, we were sitting at 2% for our results, not countywide, just for the results.
When you say that, what do you mean by positivity rate, Cheryl?
The number of positive cases versus the number of negative cases. So we get a percentage.
Okay.
So we used to be, we ran about between 2 and 4%. And here in the last month, we've jumped up to about 8 to 9%, which is significant.
Yeah, so, sure. Yeah.
We are getting between 10 and 15 positive results a day. So yeah.
Yeah. How many did you have yesterday?
We had 18 today.
Yeah.
18 positives, which were the results what was resulted yesterday.
Yeah. And just to be clear to our viewers who are watching here, we're not saying all those people are in the hospital.
No. Most of those, the majority of them have been, they were collected at Ready Care. They're out in the community. Either they were, family members, because we do see that there's several people in a family. Once there's somebody that's positive, then the whole family will come and be swabbed. So yes, there's currently right now in the hospital, we have I think 11 cases 11 positive people that are admitted to the hospital.
Yeah. Yeah. Yep, we do. So, oh, hey, Matt, would you throw up on the board the Whiteside County numbers? Matt will show those two for us too. So that's just kind of in the county. Our numbers are included, and is that right, Cheryl? And that 1,055 positives, our 530 whatever are part of that.
Correct.
Yeah, yeah. So yeah, that's just to give everyone some sense of where we're at in terms of our county. And just another part of that. So if you do the math, I think there are about 50,000 people that live in our county. So right now we're a little over 1,000, and that means that at least 2% of our county have had COVID. Probably more than that, because early on we weren't doing as much testing. We just didn't have the testing supplies. And
correct.
And even now that I know of people that just they have symptoms but they haven't gone in. So what is that? What percentage of our county have had it? I don't know. That's a tough number to come up with, but I know at least 2. I'd throw out as high as maybe 10%, because you have asymptomatic people and all that kind of stuff. So anyhow, just to give you a frame of reference. Thanks, Matt. Appreciate that. So how many tests are you guys processing in a typical day, just of COVID stuff, Cheryl?
We are processing over 100 tests a day. That some of those are tested here in house at CGH. The rest of them we send to our reference lab, LabCorp, which they go into Chicago, and they're tested in one of their facilities.
Okay. Yeah. So let's talk about that. So how are we doing in terms of our testing supply right now?
We have been very fortunate. We've been very frugal to have swabs, and there's a transport media that you have to put the swabs in. A lot of people have been unable to get that. We have been very fortunate to be able to get it. A lot of times it's back ordered, but we've been very strategic in when we order, how we order, and who we order from, and we've been able to have our supply here. We've never run out. So that's a good feeling.
Yeah. Yeah. That being said, though, you guys we haven't been able to do as much testing as we would like to do.
Correct.
More so now, but definitely earlier on it was a big issue. So
yes, it was.
Yeah. Okay. And so we do some tests in-house that are within 90 minutes.
Right.
Those are the ones that right now are in shorter supply, if I understand.
Yes.
Is that right, Cheryl?
Yes, it is.
Okay. Yeah. Now, when we do the send out labs, what are we experiencing right now in terms of the time that it takes to get those results back?
Amazingly enough, in the beginning, it was taking up to 7, sometimes 10 days to get a result back. And our reference labs have made great improvements on their turnaround times. And currently right now we are seeing turnaround times we're getting results back within 48 hours or less.
All right.
Sometimes it's close to 24, but I mean, you can't say definitely.
Right.
So almost all of them are all resulted within 24 hours.
That's nice. That is really nice.
Yes.
I know where we were at before early on. We weren't there. All right, good. So what have you been? I say this tongue in cheek because I'm sure you've had no challenges at all in this past 8 months or however the heck long it's been. So what would you say? What have been your biggest challenges in terms of COVID and testing and from a lab standpoint lately, Cheryl?
Well, it's been smooth sailing for 8 months. What are you talking about, Dr. Bird?
Yeah, right.
I have to say the biggest challenges, it changes every day. Early on, it was getting supplies, testing, and now we're seeing more still supplies, not so much the testing, but supplies. We still, have to keep looking forward. We may say that we've got, 2,000 swabs, but at 100 a day, it's not going to last very long. So we're continually, trying to get our supplies in here. But right now, I think the biggest thing is new testing and staffing. Our staff have been hit from a family member being positive or somebody that they know is positive. So that keeping staff healthy and here working has been a challenge in the last probably 3 to 4 weeks.
Yeah. So just having the staff to do what you need to do.
Yes.
Didn't you tell me that you have like a staff person committed just to doing COVID-related stuff.
Yes, we do. Yes, we do. And that person is not here today, so I've been doing those duties,
Oh, well,
and
sorry for you.
it takes quite a few hours to get all of that. When you have to enter in 100 patients a day and then do results, get those results entered in. We keep a spreadsheet, and that so that we can do a quick reference on who has been tested. It takes a handful of hours each day to take care of all of that.
Yeah. Oh, and by the way, you still do your other lab tests too, don't you?
Absolutely. Yes.
I didn't tell you I was going to ask you this because I just thought of it. How many tests a day do you do? Like, do you have some sense of that?
Routine, with throughout the lab, thousands. We do, let's see, orders, we can see anywhere up to 500 orders, which have, a lot of different tests on it. So, it could be up to, I don't know, 5,000. Monthly, we do probably almost just under 50,000 billable tests in a month. Yeah. So if you divide that out.
That's a lot.
Yes.
I'm trying to do the math on that, and it's definitely over 1,000.
Yes. Yep.
Okay. Yeah, and so so for your staff, I'm sure not only, but I hear that, and I see them, they do a really good job.
Big shout out to my staff. They have been phenomenal. When we say we're going to do something this way, and then tomorrow it's changed because of something didn't come in, or staffing aren't here, they have just been phenomenal at pivoting when we need to pivot, and showing up when we need them to show up, and working extra and staying late or coming in early. They just have been a wonderful group of people.
Yeah.
In these extenuating circumstances.
Yeah, done a very good job. What color are your uniforms again that you guys wear?
We wear wine.
I'm terrible with different colors. To me, it's maroon.
Yes.
But anyhow.
Yes.
Our maroon folks have done a great job here in this last 8 months.
Yes, they have. They have just worked. They've worked and worked and worked, and they're not afraid of going into those and treating those COVID patients, taking care of them. They have just done a great job.
They have. So new COVID tests that we hope to get in the future. Any thoughts on that, Cheryl?
Yes.
I know you don't want to say it because you don't know if you're going to get them, right?
That's the problem.
Yeah.
So right now we are running on an analyzer called the Gene Expert. It is a PCR test. It takes about 90 minutes to run. We are looking at another analyzer that it's a little small analyzer. We currently have one. It doesn't do COVID testing, but they are going to sunset that analyzer, and they have a new one coming out, which they are waiting for FDA approval on their COVID testing. So hopefully when we get that, that's going to be a game changer for us in doing more in-house testing. We also have the BioFire, which has a respiratory panel that will do COVID testing also. So for those people that are very sick and they don't know what's wrong with them, if they want to know more and they've tested negative for COVID, then we could do the BioFire and find out if there's something else that we could diagnose for that respiratory disease.
Yeah, I'm not going to hold you to it because I understand that this is just the supply chain of companies getting stuff to us has been dicey.
Yes, it has been very challenging.
Yeah. So good. All right. Well, hey, Cheryl, appreciate your time. Keep up the good work down there in the lab.
Thank you, Dr. Bird. It was great being on here.
Yeah, glad to have you. So, hey, before I let you go, I'll make sure I don't have a question or anything like that. Maybe you can just hang out in our virtual room when we're talking to Dr. Eskendari. How would that be, just in case?
That will be great.
Okay, so Cheryl will stick around if you guys have questions for her. So, thanks, Cheryl.
You're welcome.
And now, there he is. Hi, Dr. Eskendari.
Hello, how are you?
I'm good. Good to have you.
Yeah, good to be here. Thank you.
Now speak up. I'm not hearing you real great, so make sure you speak up good and loud.
Sure.
Okay. All right. Matt, let me know if you have any volume issues as we go forward, okay? So, pathology. I think I've had you on here, haven't I?
This is my first time.
Gosh, my memory is horrible. I could have sworn. I see you so much all the time. I guess I just think that we've had you here. So, well, welcome.
Thank you.
Yeah, I think the folks are going to get a good enjoy hearing what you have to say. So, in a nutshell, would you tell the folks who are listening what a pathologist does?
A pathologist is a physician that's a specialist in laboratory medicine. So most of our time is usually spent behind the microscope looking at slides and making diagnosis. We're looking at tissues, blood, different fluids, and making diagnosis, which helps our clinical colleagues treat our patients. Also, me being in the position of medical director, I'm also responsible for all of the testing that is done here in the laboratory.
Okay. So define that as you're like a behind the scenes guy that gives a lot of the rest of our medical staff information about, stuff that tests that they're ordering on their patients.
That is correct. Yeah, we're often called the doctor's doctor.
Wow, that sounds good. Now, hey, would you throw on that hat that you wear when you're reading slides? Would you put that on for a sec? I want everybody to see that.
CGH?
Yeah. This is Dr. Eskendari's. When he's reading slides, that's what he wears. See the CGH logo there? Nice. All right. Okay. Thank you. All right. Okay, let's get down to business here. Here's the first question I want to throw out at you. We're hearing a lot about these rapid tests. The Abbott lab and those kind of things.
Right.
So, what's the latest on? And we do at our hospital something called PCR testing, which is polymerase chain reaction, if I remember, something like that.
Correct.
Testing, which is very accurate. But you keep hearing about these other tests. What's the latest on these other rapid antigen tests?
Right.
Anything new?
Right. So as you said, there's basically two different types of rapid tests. One is the molecular one, which is the PCR-based tests. And those tests are very sensitive, meaning that they can pick up very little virus. If there's just a little bit of virus in the background, it'll pick it up. These other tests that are also rapid, a second category would be antigen tests. And they basically detect the antigen in the viral particles. They're not as sensitive, meaning that you have to have a lot of viral particles for the test to work.
Okay.
So these antigen tests, there's currently, as of today, there's 6 of them on the market that have been approved by the FDA. And these tests are only meant to be used while the patient is symptomatic, meaning that the patient comes in, they're symptomatic, and they only work within 5 to 7 days of patients having symptoms because they have to have lots of virus present for these tests to work.
Okay.
So that's one limitation, is that you can't use it all the time. It has to be.
So for a patient who doesn't have any symptoms, it's not going to be real helpful.
That's correct. Yeah. So they have to be within 5 to 7 days of being symptomatic.
Okay. What would be? I know we don't use those tests here at CGH. Mainly for that reason. But what are some downsides of doing that test as well, besides not picking up the test?
Correct. So for these tests to work, not only do they have to be in that 5 to 7 day window, but also there's something called a positive predictive value. And that means that your positive result that you get from a test is actually positive. And that's based on statistics and based on something called prevalence, meaning that the amount of disease that's in the community right now. So for these antigen tests to be accurate, to be reliable, meaning that if I get a positive test, that actually means that it's positive, your prevalence has to be at least 13% in the community.
What is it, 13?
13%.
Okay.
Yeah. So right now we're not quite there in our community. If in the future, way down the line, we get to be 13, 15, 14%, then we can talk about bringing these tests on. And the advantage with these tests is that they're very fast. It takes about 10 to 15 minutes to get a result.
Okay. And even if we did get them in, though, because our prevalence gets enough where there's a significant positive predictive value, we still would only use those ideally. We'd only use those on patients that have symptoms.
Correct. And also because the prevalence isn't very high, our positive predictive values are not very high either. So even if we use them today and we get a positive result, we can't be sure that that's actually a reliable result.
Yeah. So you think you're positive and everything that goes with that, and you're not. Yeah. Okay. All right, I want to switch gears with you. The chatter about this has died down somewhat, but antibody testing is different than even the other two tests that we're talking about. So what's the latest on antibody testing, and who's been using it lately across the country?
Correct. So yeah, that's right. The antibody tests are different because they're done on blood. So you would have your blood drawn, and that would be sent for antibody testing. The other tests that we talked about so far were done on a respiratory specimen, meaning that's either a nasopharyngeal specimen or an oropharyngeal specimen from the oral cavity, or sometimes in some cases saliva. But for antibody testing, we're talking about blood. So that's one major distinction I wanted to point out. And right now, antibody tests are not being used diagnostically, meaning that we wouldn't be able to use it in our hospital to diagnose patients with COVID-19. The way I think the uses that are out there for them right now, there's basically three. They're used to do epidemiological studies. So these are scientists that basically go out into a community and figure out what the prevalence of a disease is in a community. That's how they're used in one way. Another way would be to do for vaccine, verifying that a vaccine is working.
Oh, okay.
Kind of like in a research setting, these drug companies that are developing vaccines would, several weeks out would draw these patients to see if the vaccine is actually working. That is to say, if they're mounting an immune response, producing antibody that can be detected.
Okay.
So that's the second use. And then also another use, a third use, would be to identify patients or evaluate patients who have already had COVID to see if they could be used for convalescent plasma, if their plasma can be used to treat other people with COVID-19.
Okay, got it. All right, I'm going to switch gears again on you. So, flu season, going to happen. If you had a crystal ball about how you think the flu season is going to play out this year, what would your opinion be?
Bill, I'm actually very optimistic about the flu season this year, and the reason for that is that a lot of the precautions that we're taking right now in order to mitigate COVID-19 is going to have the same effect on the flu virus, because COVID-19 and flu virus are both respiratory viruses. So if we follow the CDC guidelines and wear masks and avoid crowded spaces and wash our hands and do the physical distancing, that's going to decrease the number of flu cases as well.
Yeah, I got it. I was listening to a webinar about vaccines yesterday at the Mayo Clinic put on, and one of the speakers mentioned that in the southern hemisphere, so south of the equator, which they tend to have their winter now, and they would be having their flu season, they have had minimal cases of influenza down there. And that speaker's thinking was exactly what you're saying, that some of the universal precautions we're using now are really mitigating that.
Correct, yeah. And that's encouraging news.
Yeah. That being said, I was talking to someone who we get on a emergency management call every week or so for our region, and there has been one flu case in DeKalb already. So I mean, it's not like flu's not going to happen, and it hasn't begun a little bit. But to the extent that we continue to do things that are universal precautions, I'm with you. I think it's going to make flu season not as potentially severe or as complicating with this COVID as it otherwise would be, but it will be an issue. Yeah.
Absolutely. Okay. Yeah. It's not going to go away, but it should be minimal.
Yeah.
Hopefully.
So what's the biggest, I asked most of the folks around this with me, what would you say your biggest challenge with COVID is for you right now, Farzan?
I think for me, and I think it's the same for most laboratories, is basically having the availability of testing that we want. There's been a shortage in the supply chain, and the testing that our vendors had promised us initially didn't materialize. So I think for us, the challenge has been to get the testing, and particularly the rapid testing that we do in house, to make sure that we have that test available, because that allows us to save on PPEs and basically preserve that for the sick patients that come into our hospital. So I think for us, it's just been a daily challenge of trying to make sure that we have enough supplies to do the in-house testing that we do.
Yep, got it. Makes sense.
Yeah.
All right. Well, what else? Anything else that comes to mind as we've been chatting that you want to share with the folks who are listening? Any words of wisdom?
Well, I think this whole pandemic, our original sin in this country has been testing. There just hasn't been enough tests available to do for us to do the necessary testing in the public that we need, and we've just been trying to play catch up ever since. What the reason for that is, who knows? But it's probably political, and it's bigger than us, obviously. But certainly, it's something that we're all dealing with in this country as medical professionals. Is this lack of testing?
Yeah, it's been a big part of it.
Absolutely.
Yeah, good. Well, hey, Dr. Eskendari, pleasure to have you on for the first time.
Good to be with you.
Try to get you back sometime. How's that?
All right, very good.
All right, take care.
Take care.
All right, bye.
Bye.
All right, so I just wanted to share a few other things that might be of interest to you. So I have been doing a little bit of webinar listening here about vaccines. I listened to one that the American Medical Association put on through the FDA and through the CDC, and then a Mayo Clinic one. Just for me, I thought some take-home things just that struck me. So the fellow from the FDA said that from this was an expert opinion, his expert opinion, that we would need 70% of our population to get a vaccine, and for the vaccine to be 70% effective for there to be herd immunity. So 70% effectiveness, 70% population herd immunity, which, yeah, those are pretty high bars to get to. So I think that I hear that and I think, okay, vaccine probably will be helpful. It'll be more helpful as more and more folks begin to get it and feel comfortable getting it. The other thing other things that came from those webinars that I wanted to share with you was their expert opinion was that we probably will have like one company that by sometime in late December will have an immunization, a vaccination available, that probably just in enough quantities to mainly give to healthcare workers who are on the front lines to protect them. And then sometime in from early spring through the end of the year to have more companies that will have vaccines that have been approved and have enough immunizations to go around for everybody. I saw a little blip today that even they were talking, and once again, this is all expert opinion. There's nothing set in stone because a lot of things could change. But even that perhaps some folks in their 20s may be waiting till 2022 even to get their vaccinations, just because they tend to be able to weather the virus much easier than folks who are older, like yours truly. And yeah, I wanted to make sure we shared that. What else did I want to bring up? Oh, and then Cheryl alluded to this, but yeah, we definitely have had more patients in the hospital with COVID in the last few weeks. So, prior to about a month ago, we'd be running somewhere around 2 to 5 patients in the hospital. And yeah, in the last few weeks, it's been more in that 8 to 14 range. So, it just is a percentage game. As there are more patients, more people in our area that are getting COVID, a certain percentage of them are going to get sick enough to have to be in here in the hospital and have us take care of them. Which, by the way, our teams in the hospital are doing a fabulous job, including Cheryl's team, of taking care of our hospitalized patients with COVID. So I couldn't say enough about the great work that you see our folks doing. So Thank you to all of them. All right, so a couple things before I let you go. First of all, next week we're going to be talking. We're going to talk with some of our volunteers. We're going to talk about some of the stuff that our volunteers do here at CGH, and they do a great job. And I'm looking forward to talking to the president of our volunteers about some things that they have going on here at the hospital and how they've had to adjust, and because we don't have all the volunteers here right now, and we'll talk about that next week as well. And also, just to kind of start promoting it, we are also going to start doing some video. We had a good time last week going around and talking with Bob Lehman and his construction team and the work that they're doing to build out some stuff. We're going to start going to other parts of the hospital and start talking to some folks and get them in front of you so you can get a chance to see the folks that do the work that helps to take care of all the patients that come here to CGH. With that being said, thank you for listening. Have a great week. Look forward to talking again with you all next week. Take care. Bye.